Hi, everyone. I'm Dr. Melissa Leber coming to you live from the U.S. Open. I practice both emergency medicine and sports medicine at the Icahn School of Medicine at Mount Sinai.
Hi, everyone. My name is Dr. Trevor Pour. I practice emergency medicine at Mount Sinai Hospital.
So today we wanted to talk to you a little bit about what injuries really require you to come to the emergency department and urgent care on the same day or next day and what you should look out for. Basically, if you wanted to think of some diagnoses that we worry about that require emergency care, certainly fractures when you break a bone, dislocations, so when the joint pops out of place, acute muscle tears or ligament tears are the main reasons that we want to see you right away. Ways to recognize that could be joint swelling or an inability to move the joints or an inability to bear weight. So if you can't walk, that is a good reason to come to the ER or urgent care right away.
One of the injuries that we see very frequently in the emergency department is sprained ankles, and a lot of people have trouble deciding whether or not they want to come to the emergency department the same day that they got an ankle injury. And like Melissa just said, I think the thing that really differentiates a dangerous or bad ankle injury from one that might be able to wait a day or two is whether or not you can bear weight. So I just want to reiterate her point. If you can bear weight on your ankle injury, you can try to take some ibuprofen, wait a day or two, but if you can't bear weight, you should really be seen right away and get some x-rays of that ankle.
And, you know, one of the interesting things is we actually have ER doctors here like myself and Trevor at the U.S. Open, and we also have the imaging capabilities here at the U.S. Open that we provide for the athletes, just like we provide for all of you if you were to come to the ER with an injury. So we actually have access to x-ray here on site, ultrasound, and if players need an MRI, we can send them for MRIs, just the same as if you were to come to the ER at Mount Sinai.
So after COVID happened, a lot of people were afraid to come into the emergency department for good reason, because there were a lot of sick people coming in. But unfortunately, that also led to a lot of people delaying care that they really should have gotten quickly. So we want to reassure everybody that there are a lot of safety protocols in place. We are ensuring that all patients are wearing masks, and we're separating high-risk patients from lower-risk patients in the emergency department. So if you're worried about an injury, please don't feel afraid to come into the emergency department. We're going to make sure you're safe while you're there.
I would just say, as a sports medicine doctor and as an ER doctor, one thing that we see a lot are people getting injured because in the last 4 to 5 months, because of COVID, people have been less active at home, and rightly so, because they've been safely isolating and quarantining at home. But now that people are getting out and about more, we're seeing lots more injuries, either from overuse or from being able to do exercise they thought they could do before, and now really they can't do. So ease into exercise carefully. Certainly, strength training is just as important as cardio, and don't overdo it. So, like I said in the beginning, ease in slowly, meaning do intervals, take one day off here and there, and change up your workout routine daily so that you're not always doing the same thing. So, on someone who's coming in saying they're going running 5 days a week, they're going to be higher risk for a stress fracture or other type injuries. So, in order to avoid visiting us in the ER, really try to take some of these precautions so that you can get back to being healthy and active safely.